Hi, I'm Duncan, independent insurance broker, and this video is about Medicare Part B. And the coverage for Medicare Part B is pretty easy to understand, and we will talk a little bit more about that later in the video. But what is more complicated is when to enroll for Medicare Part B, what the penalties are if you don't enroll in your initial election period, and how you may be able to avoid those penalties if you have group health insurance, and also the premium for Medicare Part B and how to pay those premiums. A quick recap about Medicare Part A. As you probably know, Medicare Part A is a $0 premium for most individuals. That's because you paid into Social Security for 10 years or longer or 40 quarters. But there is a premium for Medicare Part B. The 2019 standard Medicare Part B premium is $135.50 per month. And that's for individuals making less than $85,000 a year and couples making less than $170,000. And it's also important to know that Medicare actually looks back 2 years when determining your Part B premium. Now, if you happen to make over that $85,000 or that $170,000 as a couple, you're assessed what's called an income-related monthly adjustment amount. The acronym is IRMAA. And you should be seeing the chart right now, if I edit this video correctly, about the different incomes and what the standard or what the monthly premium is going to be for your Medicare Part B if you make over those amounts. And I'll also be providing a link to that here as well. There are several different ways to enroll into Medicare Part B. We're first going to talk about the automatic enrollment. And that's for people that are currently drawing a Social Security benefit, those that took Social Security before the age of 65. And what Medicare does is they go ahead and automatically enroll you into Part B and start deducting the monthly premium, usually of $135.50 for most people, directly out of the Social Security benefit starting on the month of your 65th birthday. And it's important to note that your Medicare Part A and B is going to go into effect the first of the month of your birthday month when you turn 65. And for an example, if you were born in September, between September 2nd and the last day of the month, September 30th, then both your Medicare Part A and your Medicare Part B is going to go into effect on September 1st. And if you happen to have been born the first of the month, in this case, we'll use the example September 1st, then your Medicare is going to go into effect a whole month early. So that's going to be effective August 1st for both Part A and Part B of Medicare. I always like to mention to be on the lookout for your Medicare card because there's quite a few people that throw them away. Especially when you're turning 65, you're getting bombarded with a lot of mail, a lot of phone calls, and quite frankly, it's easy to throw away with that junk mail. So it comes 3 months before the effective date. So we'll use September 1st as the effective date example here. So you should start looking out for that. The end of May, the beginning of June is when that's going to be coming. And it's also important to look for, it comes in a plain white envelope, and it comes from the Department of Health and Human Services. In the top left-hand corner, there is a line logo. That's my term for it. And you should be seeing that logo here. And the logo has a line logo of an eagle. And then also there's a couple other lines that form profiles of faces as well. So very important to be on the lookout for that Medicare card. If you happen to throw it away or it doesn't come, it's very easy to go ahead and call Social Security or Medicare or go online and you can actually order another Medicare card that way as well. If you're not automatically enrolled into Medicare Part B, it's something you'll have to do yourself, and there's 3 different ways to do that, and I'll describe those here in just a moment. But first, I want to give you the window called the initial election period when you can enroll into Medicare Part B, and it gives you a 7-month window to do so without any penalties, and that window is 3 months before your birthday month, the month of, and then also 3 months afterwards as well. So we'll use the September 1st effective date again. So you're going to have June, July, and August to enroll into Medicare Part B. You'll also have the month of September to enroll, and then you'll also have October, November, and December. And remember, the soonest the Medicare can go into effect is the first of the month after you go ahead and enroll. But if you enroll in June, July, or August in this situation, anytime during those 3 months, it's going to go into effect September 1st. And then if you happen to enroll, let's say September 20th, then your Medicare Part B is going to go into effect October 1st. If you've happened to miss that 7-month window when you turn 65 to enroll into your Medicare Part B, And there is what's called a general enrollment period, and it happens every year, and that's between January 1st and March 31st, and then your Medicare Part B will go into effect July 1st. And that happens if you don't have a special election period like group health insurance. If you lose your group health insurance, then that provides you a special election period to go ahead and enroll into Medicare Part B, and it'll become effective the first of the month after that you enroll. And because you had group health insurance, you're most likely not to have any penalty as well. And I'll talk a little bit more about the penalty a little bit later. There are 3 different ways to enroll into Medicare Part B. All of them are pretty simple. The first way is to simply call Social Security. You don't call Medicare. You call Social Security, and that phone number is 800-772-1213, and you should be seeing that on your screen right now if I've edited this video correctly. Or you can go ahead and go down to your local Social Security office, make an appointment. Most people that do that, generally they have some questions about when they want to take Social Security and how much their benefit will be. So they're knocking out 2 birds with 1 stone. And you can go, like I said, to the Social Security office and they can take care of you there. Or if you're comfortable, you can simply go online. It's the fastest and easiest way to do that. And the website, there's several different websites. They all take you to the same one, but the easiest one that I know of is ssa.gov/Medicare. Again, you should be seeing that link right here. You just go to ssa.gov/Medicare, and then right in the front of the page, it'll say apply for Medicare only. You can click on that, and then that will get you on your way. You will need to make what's called a My Social Security account. If you haven't done so already, if you have, you just have to get your username and password and log in. But if you haven't made a My Social Security account, they will ask you to do so, and the links will be right there in front of you to go ahead and make that account so you can go ahead and enroll into your Medicare Part B. It's very important if you don't want to enroll into Social Security at the same time as your Medicare Part B, that you do push the buttons inside of the website to enroll into Medicare only, and then that will get you going into Medicare Part B. If you've enrolled into Medicare Part B manually, you're going to need to get that premium taken care of because obviously you don't have a Social Security benefit for it to get paid automatically. And there's a few different ways to do that. All of them are very easy. The easiest is to simply have it deducted out of your bank account, and that'll happen every month. Or what Medicare will do is they will send you a bill, and that's going to come every quarter, every 3 months. And you have a couple of options. You can fill it out and you can write a check and mail it back. It goes to St. Louis. Or you can go ahead in the same bill that you get, you can actually fill out your credit card or your debit card number and send that back to Medicare, and the address is in St. Louis. Enrolling into Medicare Part B is totally optional, as you know. However, if you do enroll after the 7-month initial election period, you will likely incur what's called a late enrollment penalty, unless that you currently have group health insurance either through your work or through your spouse's work. And to avoid the penalty, you have to have what's called credible coverage. And almost all group health insurance is credible coverage. I've helped out over 1,000 people personally with Medicare. And I've also trained agents all over the nation and got many questions from them about their client that is turning 65 and that's losing their group health insurance if it's credible. And I just tell them to check with the group benefits administrator. They usually know right off the bat, very easy to ask them. And it's only been in a handful of situations, less than 10, that we found group health insurance that wouldn't qualify for avoiding the late enrollment penalty. If you have lost your group health insurance and then would like to enroll into Medicare Part B, you certainly can do so through the special election period and avoid the late enrollment period like we've just mentioned. And the time frame to do so is you have 8 months from the time that you lose your group health insurance to go ahead and enroll into Medicare Part B without any penalties, and you can also have it in effect right away. If you happen to enroll after that 8-month window, then you may incur a late enrollment penalty, and you will also have to wait for the general enrollment period, like we've mentioned, is from January 1st to March 31st, and it becomes effective on July 1st. This is extremely important to note. I do get this question from time to time, and people think that because they have COBRA coverage from their work, generally what's happened is they're getting COBRA before they're turning 65, and then they turn 65 and that COBRA continues, if that COBRA coverage is considered credible coverage to avoid the late enrollment period, and it is absolutely not. So if you do have COBRA coverage and you want to avoid the late enrollment penalty, you are going to need to enroll into Medicare Part B during that initial election period, that 7-month window. Next, I'd like to talk about VA benefits as related to the late enrollment penalty for Part B and Part D of Medicare. If you are a veteran and you're getting Veterans Association benefits and you do not enroll into Medicare Part B and you didn't have any other group health insurance and you wish to do so outside of your 7-month initial election period, then you will have to wait for the general election period, January 1st to March 31st, for a July 1st effective. And in all likelihood, there will also be a penalty for that. Now, that's different than for Part D of Medicare, for the drugs, because you do have VA drug benefits. And if you do wish to enroll into Part D of Medicare later, then there will be no penalty for that, because VA benefits for drugs is considered credible coverage. So again, if you enroll into Part B of Medicare later, and you have VA benefits and you're relying on not having to pay the penalty because of VA benefits, you will have to pay the late enrollment penalty for Part B, but you will not have to pay a late enrollment penalty for Part D if you enroll into Part D outside of your initial election period. Now that takes us to the late enrollment penalty. And as we know, that happens if we don't have any group health coverage or we enroll outside of the 7-month initial election period. And forgive me, I am going to read this section and it'll pop up on your screen as well, and also do a little bit of the math, but I want to make sure I get this exactly right. And the penalty is an extra 10% for each full 12-month period you do not have Part B. For example, if you don't have Part B for 27 months from when you become first eligible, and then you choose to put it in place, the penalty will be 20% extra of the standard Part B premium. Also, if you don't enroll when you're first eligible, then you'll likely need to wait for what's called the general enrollment period for Medicare, and you can enroll between January 1st and March 31st, but Part B will not become effective until July 1st. So let's say we're figuring this out right now for someone, and the standard premium for 2019 is $135.50. They will have a penalty of $27.10 per month. So that's $135.50 times 20%. And that's $27.10. And when you add that to the $135.50 standard Part B monthly premium, that total is $162.60 that they'll be charged for their Part B of Medicare. And remember, this penalty is for a lifetime and can go up as the standard Part premium goes up as well. That's it for the complicated part of Medicare Part B. Now let's get on to the easy portion, and those are the benefits of Part B of Medicare. And as you know, Medicare Part B is called medical insurance. It says it right there on your Medicare card. And it's known for doctor insurance or outpatient services. Easiest way to think about Medicare Part B is it'll cover you for going into a building and coming home the same day. It's your outpatient services. Again, that's an oversimplified view of it. However, if you want to figure out quickly what part of Medicare is going to cover, if you go into a building and you come home the same day, more than likely it's going to be covered under Part B of Medicare. And then just to recap on Part A of Medicare, which is inpatient coverage, if you go into a building and you stay overnight, then more than likely it's going to be covered under Part A of Medicare. A list of examples of what Part B Medicare pays for. This certainly isn't an all-inclusive list. It includes, but it's not limited to, our preventive screenings like cancer screenings, laboratory tests for having our blood drawn, our x-rays, our MRIs, our CAT scans, physical therapy, occupational therapy, durable medical equipment like wheelchairs and oxygen, and then also covers us for our ambulance services. And like Part A of Medicare, Part B also has a deductible and coinsurance that the Medicare beneficiary is responsible for. The costs I'm going to talk about next can be covered by a Medicare supplement plan, and the Part B deductible is $185 in 2019. Unlike the Part A deductible, which you could be charged for each admission going into the hospital, the Part B deductible is required to be paid once per calendar year. Now, I do get a lot of questions, Chris, on the Part B deductible, do I have to pay it for each service that I get? No, it's generally for the very first service, maybe the first or second time that you see a doctor during the year. And then that should satisfy your Part B $185 deductible. And that $185 is quite manageable for most people. Unlike your group health insurance that you may have, or your individual health insurance that has $1,000, $2,000, maybe as much as a $10,000 deductible, the $185 deductible is quite low. The potential big costs of Medicare Part B come from the coinsurance. The coinsurance is 20%, and the most important part to remember is there is no maximum for what the Medicare beneficiary is responsible for with the coinsurance. Just like the Part A deductible and coinsurances, there's no maximum. There's no maximum for Part B coinsurance as well. And the 20% is worked off of the Medicare approved amounts. If you have a procedure that's maybe $5,000 for the Medicare approved amount, how much the providers get reimbursed for, then the Medicare beneficiary in this example is responsible for 20% of the $5,000 or $1,000. Probably manageable for a lot of people. However, if you become very sick and you have to start seeing the doctor a lot and incurring a lot of Part B costs, they can add up, and I'll use an extreme case. It's highly, highly unlikely. However, it does happen. If you have a lifetime of $1 million Part B bills, then you'd be responsible for 20% of that, or $200,000. And that could be very difficult for most of our seniors that are on fixed incomes. This covers the basics and a little more about Medicare Part B. Tried to present this in an easy to understand fashion, and like I mentioned in the beginning, I'm a licensed independent insurance broker, and I help people with their Medicare choices because, as you can well see, Medicare doesn't pay 100% of the bills, and you can purchase a Medicare supplement plan to take care of the Part B deductible and also the 20% coinsurance as well, extremely helping out with the unpredictable Medicare costs. And helping Medicare beneficiaries understand Medicare and the extra costs is how I make my living. And I hope you allow me to help you choose your Medicare supplement plan. We can provide you a quote free of charge wherever you are in the nation. And all of my services are always absolutely free, whether you purchase a Medicare supplement plan or not through us. If you just have some questions and would like to contact us, feel free. Again, my name is Chris Duncan, and you can contact me at 800-910-3382, and we'll talk with you very soon. Thanks again.